I would say that this is more like the closest that you would get to having your natural teeth, and having that many in there to preserve your jawbone and feel extremely secure when you're biting into food and eating food. It just feels like all my natural teeth are here now, minus hot and cold sensitivities. I love this question, and I actually did interview my dentist recently, so I'll be editing and posting some clips of what my actual dentist who performs these procedures has said about this. But one thing I'm not going to do is tell you that one procedure is better than another, but I will tell you that any dental implants can be such a blessing in your life. I have my own personal preferences for why I chose the one-piece mini implants, and that's what I have with my fixed zirconia bridges. So there's a few things to consider. So like an all-on-4 type of procedure, those are full-sized implants, but they're two pieces, and they're called screw retained. So the implant goes in your jawbone. Now there's an attachment that goes on over top of that, and then the bridge would attach to those screws and be screw retained. So with mine being cemented and having more implants spread across the jawbone, it's a little more comparable to having bridges on your natural teeth if you're missing teeth. And I actually did have bridges like that prior to having this done. And I had them for 10 years before I had an abscess above a bridge. We had to remove it. That's another story for another day. So there's a few benefits. So when you get a bridge cemented onto the mini implants like that, it's spread all across your jawbone rather than just having like two larger full-size implants in only two spaces. And I believe there's 4, not 2. So it would still just be the 4 wider diameter full-size two-piece implants. So having more implants can mean that your bone stays more intact in those places, all evenly across the jawbone. It gives it more of an even bite force. If you have more implants and one of them has a problem, breaks, fails, whatever the case, it's not a system failure because there's plenty of implants in there, so you can replace the one that is a problem. With the all-on-4 type, you usually, if you lose one of them and have a problem with one of those implants, they have to redo that whole implant, but then you don't have enough implants to, you know, maintain the bridge the same way that you would with these that are cemented. Another benefit would be that when these are cemented, it's just like it's like crowns and bridges that are cemented on your natural teeth. Nothing gets under cement. You don't take a cemented crown or a cemented bridge off to clean under it because you can't. You clean around the gum line, you clean around the surfaces, but being filled with cement, there's nothing that gets under it. So there is no concern of like bacteria getting up under there, versus like the all-on-4 with the screw retain type two-piece implants. Those do have a micro gap where bacteria can get into it, and it can cause deeper infections that can get deeper in the tissues and become a bigger problem. Another benefit would be just the fact that this is easier to go through. It's a lot faster. These mini implants are mechanical in design, so they self-thread into the jawbone, but that's it. There is no other piece that goes with it, so it's just one and done. Here's a few benefits. Anybody that can get dental implants done and get permanent teeth, it's such a blessing. So it's more a matter of just looking into the options, knowing that all dental implants can be a great option, but they're not always the best option for all people. With myself, I didn't want to jump right into full-size two-piece implants that are more expensive. They are more invasive. Some people would say, or some people believe that they're better, but my dentist did those types of implants for 15 years before he started preferring the mini implants, and that was because the full-size implants had their own issues. They were much more invasive, and the complications that can arise from those are a lot more severe than any potential complications that you can have with these. These are easier to remove. They're smaller in diameter, like narrower, but they can make them wider. The risk versus reward, I feel it's a lower risk and an amazing reward, and less expensive and less invasive, less time consuming, less time to heal. It's one and done. There's not a multi-step procedure where you have to place the implant, allow the implant itself to heal, and then put the attachment on it. And actually the piece that attachment attaches to is narrower in diameter than the mini implants, so you can actually still break a full-size implant above the gum line where that attachment is, and if that does happen, they have to remove the whole implant. And if you don't have as many implants, you can see how that could become a problem and a major setback, and it can take much longer to heal from that, and then get a new one placed, and then you have to let it heal, and it's a multi-step process. So it can take longer, and sometimes people can't just snap right into them. Sometimes they have to wear like a healing denture like a traditional denture over the implants while they heal until they get the second piece. So that wasn't something I was interested in either. Another major benefit is that these single piece mini implants are a good option for people that do have more bone loss, because the full size 2-piece implants, they're not a great option for people that do have bone loss, and they do typically require bone grafting and sinus lifts. And the reason that the single implant, the mini implants, the reason that you don't need bone grafting and you don't need a sinus lift is because they're just the one piece, and they can angle it into the best bone that you have and away from your sinuses, while also avoiding the nerves in your face. And because they're more narrow in diameter, it's just not, you can do more of them. That makes sense. I'm just extremely happy with my choice, and I love them. I'm a huge advocate for mini 1-piece dental implants. If I left anything out, please feel free to ask me more questions. I love them and look forward to the videos that I'll be posting of my dentist answering some of these types of questions from the dentist himself, who does all the implants. He does them all. So anyways, thank you. Have a good night. Mwah!